Welcome, and thank you for joining us for this Flinders University Brave event, Patient Education in the Digital Age, Could an Avatar Save Your Life? My name is Belinda Lang. I'm an Associate Professor and the Research Theme Lead for Technology in the Caring Futures Institute at Flinders University. I'm really excited to be hosting this event as it's a topic that I'm very passionate about. But before introducing our speakers tonight, I would like to acknowledge that we are hosting this forum on the traditional lands of the Kaurna people, and we pay our respects to their elders past, present, and emerging. This evening's event is delivered as part of our Brave lecture series. Why Brave? Because through our series, we showcase our researchers who challenge the status quo and bravely investigate with a view to resolve some of the big societal challenges of our time. This series is also supported by our presenting partner, Bank SA. Tonight, we are fortunate to be hearing from Professor Robin Clark, who is leading patient self-care initiatives by leveraging digital technologies. Also participating in this discussion is Justin White, CEO of animation and game design agency MonkeyStack, and co-designer Joe Garuccio. I'd like to remind the audience that if you are unable to join us for the duration of this live stream tonight, you can watch it later as we are recording this event. The event recording will be available on our website, flinders.edu.au. As always, we are keen to make this an interactive event tonight with a live Q&A session. This is your chance to participate in the discussion and pose questions to our speakers in real time. We do ask, however, that everyone please treat this forum as a place of respectful engagement, where people are treated with dignity and differing views are tolerated. We're ready to start receiving questions now via the message function on this platform, or you can join the conversation on Twitter using the hashtag #BraveResearch. And so now I would like to formally introduce our keynote speaker tonight, Professor Robin Clark. Robin is an internationally recognised senior clinician and researcher who leads the Caring Futures Institute's Better Care theme. The Caring Futures Institute is Australia's first fully dedicated research organisation for the study of self-care and caring solutions. Robin's research is focused on heart health with an interest in increasing access to services for heart failure and heart disease patients. She also investigates technology in health delivery and prevention and services for cardiotoxicity after cancer treatment. A former Heart Foundation Future Leader Fellow, Professor Clark is also a Fellow of the Royal College of Nursing, a Fellow of the American Heart Association, a Fellow of the Cardiac Society of Australia and New Zealand, and a life member of the Australian College of Critical Care Nurses. There is no doubt that Robin's heart is well and truly invested in finding better care solutions for patients. I'd now like to invite Robin to begin the discussion.
Thank you, Belinda. Thank you very much. Very nice introduction. Well, of course, I can't begin my presentation without acknowledging the fantastic nurse researchers with whom I work, and more importantly, who've made a major contribution to the work I'm about to present to you tonight. So I sincerely acknowledge all of my team and their contribution to the research that I'm going to present to you. So that's me. When I was a young nurse, I had a dream. I wanted to be Princess Leia. And you can see that I was serious about that because I've got the hair thing going on there. But the reason I wanted to be Princess Leia was I had this idea that if R2D2 could deliver me as a 3D hologram to people's homes, I would be able to check up on them and see how they were going. And this would be an amazing way to get to maybe 300 homes in a day. So I kept this dream. Fortunately for me, I work at Flinders University in the Caring Futures Institute. And at Flinders University, dreams can come true. And what you're seeing here is a group of researchers from Tonsley who have developed 3D holograms. And just recently, they made the first 3D hologram telephone call to London. Unfortunately, they're not quite ready to be introduced into the Flinders Medical Centre nursing suite yet. So while I'm waiting, I'm also channeling my second favourite movie, which is Avatar. And avatars are also included in gaming, and gaming is a new approach to nursing and patient education, which is actually gaining momentum in the current system. So perhaps my idea of changing the way we educate people comes from what I see in the real world. As you can see from this slide, this is what we are seeing all around us in the real world, patient receiving information and communicating. Unfortunately, this is not what I see in the GP office or down at the hospital, and this is how we continue to deliver information and education to our patients even right now as we speak. Now, is this information effective? Well, one of my favourite researchers, Jeremy Grimshaw, has just released a new report to say that, unfortunately, printed medical education materials, pamphlets and booklets make little or no difference to patients' health, which must be disappointing to the people who are making those pamphlets. And unfortunately, now that we're converting a lot of our information to the internet, at the moment, if you just upload a pamphlet or a booklet onto the web, it actually has no better influence on a patient's health or their outcomes. But luckily for me, there's a new generation of digital health researchers, nurses, doctors, allied health people who are looking at different ways to present nursing education and patient education. And we are studying these forms of digital technology education, and the evidence for improving patient health and outcomes is very strong. So we also need to consider who we're teaching in this technology and pamphlet and booklet age. And this slide is another one of my favourite movies, One Flew Over the Cuckoo's Nest. But the message from this slide is one form of education won't suit all patients. So who are we teaching? When a nurse is delivering patient education, he or she needs to consider the age of the patient, their hearing, their sight, the sex of the patient. In some cultures, gender differences can affect the way patients take on information. We must be very respectful of ethnicity and culture. And one of the biggest issues that we're dealing with in Australia is the variation in literacy and health literacy. Patients who are depressed don't learn as well as those who are not. And self-efficacy is the outcome of the education, where it gives the patient, having knowledge gives them the confidence to implement what they know into their self-care. Engagement is important. So it's well known that patients get very scared when the doctor in the white coat starts telling them information that they may not want to hear. And of course, we digital educators need to be careful that we don't expect to deliver digital education to patients who don't have proper access or internet access. So we have to be aware of appropriate access for our digital tools. So just some information to give you a bit more of a profile of who we're teaching. 1/5 of Australians currently come from overseas, and almost half of Australians have at least one parent who was born overseas. And interestingly enough, 1 in 5 Australians do not speak English at home. As well as this, it's suggested by the Australian Bureau of Statistics that almost half of Australians are functionally illiterate. Functionally illiterate means that you can't read a map, you can't read a recipe or implement it, and you find it very difficult to read the instructions on a medicine bottle. For me as a nurse, another challenge is the reduced length of stay in hospital, where one time a heart attack patient may have had a leisurely 7 to 9 days in the coronary care ward. These days it's more like 1, 2 or 3.2 days. And the skills and confidence of new bedside nurses are variable as well. So why are we not working harder to make practice more like the real world? That's such a good question, because there are currently 7.6 billion people on the planet, and it is known that there are 4.77 billion mobile phones. So almost half of the planet has a mobile phone to which you can communicate with. And more interestingly, 85% of the Earth's surface currently has Wi-Fi. COVID or no COVID, we still have Wi-Fi. So why do we continue to hand out brochures to illiterate and non-English speaking patients? And why are we not using technology more than we do? So in case you're not sure, an avatar is an icon or a figure representing a particular person or a computer game or internet forum. And avatars are actually becoming, or avatar-based technologies are actually becoming more and more prevalent in education, in schools and in health and in hospitals as well. So the principles for developing our avatar teaching apps is 3 steps in 2 cycles. Our first step, as you can see down there with my team and other clinicians that we work with, we look at the guidelines, we work with the Heart Foundation, we make sure that all of our scripts are word perfect according to research and evidence. Then we take our concepts, our storyboards, to our co-designers, our consumer representatives, our patients, who give us feedback on the concepts, the designs, the length, the fonts, the buttons, etc. And then finally, we take these concepts and storyboards to our gamers and IT developers, where the magic happens and our avatars come to life. And there's just some concept designs of the different versions of our Nurse Cora over the last few years that we've been working on her. A lot of people are surprised at how much science goes into these education tools. And one of the most important things that the gamers taught the clinicians was that we were way too serious in the way we were teaching, and that we'd lost a bit of fun, and that fun was a way to engage, and it was likely scientifically proven that you would learn more if you were relaxed and engaged. So a good lesson from the gamers there. We were looking for more interaction, like opposed to pamphlets and booklets, rather than having a didactic lecture from someone in a white coat on an iPad. We certainly could do a lot better than that. We also looked at the science and the principles for web design for elders. In these scientific principles, you use pictures rather than words. Only try and have one message on each slide, and use a combination of a picture, speech and words to deliver your message. So what we have, or what we developed from our principles, was word perfect from the guideline education sessions. Very few humans can say they can do that. The other thing was attention span and how long these things could be. Our philosophy is the education session shouldn't really be much longer than a song from your playlist, which is about, as you know, as long as a message really should be. And we also use science in the images that we present. So we've got animations for our avatars, but we use real world pictures to show symptoms, etc. And they are based on science. So if the symptom is a male symptom, we have a picture of a male portraying that symptom. Our avatar Cora, Nurse Cora, is deliberately designed to have international features such as dark hair, dark eyes, and dark skin. And if we chose to, with just the press of a button, she could be speaking 144 languages through computer translation. The other thing is that all of our apps are internationally recognised from international guidelines, could easily be adapted to other diseases like diabetes and cancer, and we would easily fit into other healthcare systems. So our family of Avatar, we have Nurse Cora, and Nurse Cora has been teaching the Emergency Heart Attack Action Plan, and the 6 things you need to know when you're going home for hospital after a heart attack. And we're currently giving Nurse Cora a Scottish accent to teach atrial fibrillation to patients in Scotland. So we're not kidding, she is internationally famous. As well as that, we have Bob and Mary, who teach how to live well with heart failure. And as I mentioned before, we are also looking at translations, perhaps a little bit more sophisticated than the computer version, with Aboriginal and Torres Strait Islander versions underway. And we're looking at beginning to translate into the 6 top languages spoken in Australia, which are Mandarin, Arabic, Cantonese, Vietnamese, Italian, and Greek. So, what is Nurse Cora teaching that's going to save your life? Well, one of the most important things are the Heart Foundation guidelines for when you're having a heart attack. The important steps are recognise your symptoms, stop and rest, talk, tell someone what's happening to you, take your medication if you have it, angina medication, and repeat a dose every 10 minutes. If after the 2nd dose your symptoms have not gone away, you need to call 000. And 000, the ambulance, is going to bring health services to you. So the paramedics will begin your treatment immediately upon arrival. So it's not just transport. And we often say you should chew half an aspirin while you're waiting for the ambulance to arrive. This is the new guideline. So could an avatar save your life? Well, I just want to have a small mention of the epidemic. Hard to not mention it in a talk like this. So we have learned a lot from the pandemic. The most important thing was that during the lockdown, as you can see, heart failure patients in the green and red bars stopped presenting to hospital. And heart attack patients in the curves in the top right-hand corner also stopped presenting to hospital. There is no way that we cured cardiovascular disease during the pandemic. So the consequences of this is shown in the bottom bar graph, and I'm sure you're all used to seeing curves and graphs by now, that the out-of-hospital cardiac arrest when your heart stops has actually doubled. The connection between this, there can be many causes for cardiac arrest, but we definitely think there is a connection between this. So the most important thing is that patients were reluctant to go to hospital in the normal times and now are doubly reluctant to go to hospital. The most important message from Cora is whether it's COVID time or normal times, if you're having heart attack symptoms, you must go to hospital. And in pandemic times, the doctors and nurses will protect you from COVID. So, can an avatar save your life? Well, yes, we think so. We think Nurse Cora has great potential. And in our clinical trials, in our early clinical trials, we've shown significant improvement in symptoms and knowledge and attitudes to responding to heart attack symptoms. We've definitely shown significant improvement in ambulance use. And participants have reported that the app helped them to feel more confident, which is that self-efficacy that I was talking about before. And as I said, we are now planning a large clinical trial, which is under submission. So we'll be able to show how we've saved lives and the number of lives that we can save with these apps. So ladies and gentlemen, it is my pleasure to introduce to you Nurse Cora.
Hello, my name is Cora and I'm a nurse. I've been looking after people with heart conditions for a long time. At any time, you can tap on the menu button in the top left-hand corner to go to a specific section. It is important to understand that warning signs can vary from person to person. Tap on the pictures for more details. Discomfort or pain in your jaw. People who have experienced discomfort during their heart attack describe it as an ache or a tightness in and around the lower jaw. You may also experience other signs and symptoms. You may feel dizzy or lightheaded while experiencing other heart attack symptoms. You may even feel faint or collapse. The first step is stop. If you experience any of the warning signs I have shown to you, you should immediately stop what you are doing and rest. You will also be given advice on what to do while waiting for the ambulance to arrive. Here are a few questions to see if you've remembered what to do if you are having a heart attack. When you experience any of the warning signs of a heart attack, is it best to stop and rest immediately? Sorry, that's not the right answer. You have scored 3 out of 6. Perhaps we should go over some of the information again. It is very important that you are confident about the warning signs of a heart attack and knowing what to do when they appear. That's a lot to go through in a very short time. If you have any questions, make sure you ask your nurse or your doctor. They would be very happy to talk to you about it.
So, with the amazing success of Nurse Cora, we decided to, we were lucky to get some more funding, and we decided to go into designing some education apps for heart failure patients. But this time we decided we would use peer teaching rather than a nurse presenting the information. And the reason for that was that we had had interaction with Aboriginal and Torres Strait Islander patients, and they had told us that they'd prefer to learn from someone like them who had heart failure. So as you can see, we've also done a clinical trial on our Fluid Watchers app, as we call it, and you can see from the yellow dotted line that this also had a highly significant improvement in knowledge and the overall satisfaction with our Fluid Watchers heart failure app has been up in the 91% range. So also heart failure patients really enjoyed learning this way. Again, our next step will be to design a big clinical trial to show the number and how we can also reduce hospitalisation in heart failure, which is a major issue. So ladies and gentlemen, it's my pleasure to introduce to you Bob and Mary.
Who would you like to talk to today? Do you want to customise your character? Hair colour, eye colour, skin colour, glasses, clothing colour, weight?
Heart failure is when your heart can't pump blood around your body that well anymore. Take a look at this video to see if it helps you to understand.
Our heart beats around 60 to 100 times a minute when it's healthy. Weigh yourself every day. This is the best way to monitor any changes in your body that could be caused by fluid buildup. Yes, you should check your legs, and this is what they may look like. Correct, and they may swell like this.
Just remember the 4 W's. Wake, wee, weigh, and write. New or worsening dizziness, confusion, sadness, or depression. Increased trouble sleeping, or you cannot lie flat. We've now reached the end of this section. Are you ready for a quick question to test your knowledge? When we have chest pain, we should Keep up the good work.
So just before we go to the panel discussion, I want to ask you if you noticed the little secret message that the gamers put on Mary. So if you notice, she's actually wearing a little pair of red glasses just like these. So thank you, everyone. I hope you've enjoyed our presentation and overview of the development of our avatar teaching apps. And I look forward to now introducing you to Joe and Justin, our team members who've made it all happen. Thank you.
Thank you, Robin. Now we are starting to receive a few questions from the audience, but I'd like to encourage you, if you do have any questions, to keep posting them. And we will try to get to as many of your questions as we can this evening. So to get the discussion started, Justin, could you tell us, games have sometimes had a bit of a bad reputation over the years, anything from gambling to adult content and violence. What do you think, or why do you think they could be used for health?
Yeah, I guess games are an incredibly engaging medium. We've seen a lot of the youth uptake in games, mostly probably because they've got the time and they're more technologically savvy. You know, they're an amazingly compelling way of delivering material to people. They provide gamified sort of challenges. They put forward in front of users and gamers that they can overcome, that they feel like they have succeeded at something, and they get that feeling of success and achievement from those games. And yes, a lot of games have been violent and they've got a bit of a bad rap. We've got poker machines, all that sort of stuff is out there as well, because it does trigger something in our brain. We are just drawn to them naturally. And if we zoom out a little bit, I mean, games themselves are integral to us being human. I mean, we look right back to childhood and our parents are teaching us games really early on. We're talking like peekaboo and hide and seek and hopscotch, you know. From birth, we're almost trained to, you know, and we get delight from games. And I think as we get older, we become more sophisticated with our games that we play. Right to every aspect of our lives is in some way you consider is kind of gamified, and role-playing games are a perfect example of that, where you embody another character in this mythical world and advance through this fictitious world that people have generated. But our lives are like that too, you know, where we either set challenges for ourselves that we work towards and we overcome and we experience that level of achievement. We've attained that goal. Very, very similar in treatment in games. So I don't see why we should go, well, games are bad, because then you're saying, well, humanity's just bad, or the way that we've been brought up is bad. You know, games can bring a lot of enjoyment and fulfillment and bring achievement and make you feel successful. So I think as we have become more sophisticated in our games, there's no reason why we can't be delivering, you know, real world lessons like our parents gave us as kids through games as adults or elderly. I don't see why we should divorce ourselves from that.
Mm-hmm. Thank you. And yes, just taking some of those game design elements and using them for good. Yeah, that's really great. Yeah.
Yeah.
Joe, how did you become involved as a co-designer and collaborator in this group?
Yeah, great question. I was actually 37 going on 38 and I had heart failure. I had a big bout of heart problems and yeah, I was there basically in the Queen Elizabeth Hospital and I was lost. I was lost and I'm getting medicated and trying to sort my life out and I'm worried and stressed and I met my cardiac nurse. And she was amazing, but she delivered all this information to me really quickly. But like I was still worried, am I going to live? Am I going to live? Like I didn't really care what she was saying. It was I just wanted to know if I was going to live because they weren't sure what the extent of everything that was happening to me was yet, and I was in a lot of fear. And it's a lot of information to take on board, and I probably didn't take on much. But, you know, going through and meeting all these people, you know, it was the most beautiful experience. But when I've been in an experience, when I've been down and feel lost in this world, I've always like wanted to give. I know that we can give. And, you know, like I felt like I'd stepped so backward. I went so far backwards physically, but, you know, as a person, I grew so much in this experience. And I still had the heart to be able to ask if there's anything I can do to make a difference. Because I believe that we go through things to learn and grow, and that it's not just for our benefit, but we give that off to others to make a difference. And I would always ask my cardiac nurse, I'd ask everyone, I'd ask, is there anything I can do? Like, even though I'm the one and they're trying to do for me, I wanted to do back in gratitude. And, you know, it got through. And, you know, there was a few studies that were going on, and they got me involved in them. And then my energy obviously, you know, got through to Professor Robin. And, you know, this lady rang me up and goes, well, Professor Robin wants to speak to you. Like, she's wondering if you'd want to go a little bit further and do something with her. And I was like, yeah, of course. Like, that's what I wanted to do. And, you know, from that moment on, you know, from feeling so down, and I'm very hard on myself, you know, and I just felt lost. And I'm like, oh, no, now I'm going through this. You know, this has been something that really gave me the ability to, even like now I have bad weeks where I feel down, but like then I think about what we're doing now and I think, you know what, I'm proud of myself for that, you know, and like Professor Robin is just someone like that I look up to so highly. Like, she's dedicated her whole life to like wanting to give, and I love that because that's the way I am. I just don't have the qualifications as such, but I've got the heart. I've got a big heart, love to give, and yeah, that's what I want to do with my life because it makes me feel good, and yeah, it's beautiful to be here.
Thank you for sharing that, and it's just it's very inspirational, I think, you know, to want to give back and to, you know, especially in those times when you're down. Thank you. Our audience member Steph asks, I am a heart patient. How do I get access to this technology?
Well, Justin and I are currently working with the Heart Foundation, and we're just doing a bit of paperwork, but we're hoping that at least by the end of the year or early next year, they will be available for free on the Heart Foundation App Store. So as Joe was saying, giving back, we also have that philosophy too. We don't want to charge. It's going to be a free download, just a bit of paperwork to be done, and then we'll let everyone know through the Caring Futures Institute when they're available.
Great. And Robin, while I've got you, I guess you've been teaching your consumers a lot, but what have they taught you?
That's a great question. Absolutely. Well, the idea of the song came from consumer feedback, how long these things should go for. And that's, I think an average song is between 3.5 minutes to 4 minutes. So that's probably good advice. The other thing was, I think the web design for elders, you know, that one of the constant feedback was colours that elder eyes can't see, like red. And they said, please make the font a decent size because mobile phones are so small. And also buttons, they complained about the buttons on mobile phones being quite small for elder fingers. So there was a lot, a couple of small things. Mary's Pearls came as a feedback from one of our lady co-designers. She wanted to see something there. And I think Nurse Cora, when the real nurses saw Nurse Cora, she was way too skinny. And they said that she should be a healthy size 12. So we gave her body a more realistic tone to it. So an amazing, and her hair was too perfect. We had to muss it up a little, so there's little bits that stick out. So all of the feedback has been incorporated, you know, to our gamers. And I think the magic actually happens in voice as well. The voices of Bob and Mary and Cora, they're actually actors. So they're not those elevator voices that you hear when you get to the 8th floor. And so we've spent the money on using real-world actors, and I think they're quite enchanting, and I think that's part of the engagement. Like Nurse Cora is the bubbly, happy-go-lucky nurse that you want bouncing next to your bedside and telling you with great enthusiasm and passion what you need to do to stay safe and well outside of hospital. So all of that feedback has come from our co-designers. It's been a delightful experience, and as we're going forward to our Aboriginal and Torres Strait Islander versions, the process is, we go and engage and recruit Aboriginal researchers to help us. And the first step they told us the other day in a meeting was we should ask the Aboriginal people if they think this is a good idea. Well, I thought, oh gosh, I can't remember asking that question of our non-Indigenous co-designers, but I'm pretty sure they told us it was a good idea all the way in all of the meetings. Yeah, thanks, Joe. So it is a good idea, but we still should ask that question because a lot of treatments patients don't actually think is a good idea, and they're either non-compliant or they just won't come to the clinics or meetings. So yeah, that's great feedback. Co-design, I wouldn't do anything without permission of consumers, co-designers and patients. Yeah, it's for them after all.
It's interesting drawing from that some of those obvious things that you take for granted or some assumptions that you make that are really important to double check, but also the little things, isn't it? That all of those things that you listed initially were the little pieces that actually add so much more to the experience.
Yes, I think a lot of that's what makes our app stand out internationally. We have presented our work overseas in some of the most important meetings, cardiac meetings around the world. As I said earlier, the Bob and Mary app is being presented in the prize session at the Cardiac Society of Australia and New Zealand in a few weeks' time. And so I think it's got global appeal. But the difference between us and the other 5 million apps on the App Store is that we're co-designed and we're clinically tested. And many apps are developed by good, well-meaning doctors and nurses who go, this app will be good for you. But hey, they never ask the fundamental question, do you want to learn this way? Do you think this is a good idea? So a great advice to any clinicians out there who are interested in becoming involved with digital health and digital health teaching.
And another aspect in that is, does it do what you say it's going to do?
Yes,
so,
does it work? Does it improve knowledge? Does it save lives? It's a very important point.
Joe?
So I'd say.
Yeah.
Confidently.
Yes.
Yeah,
Good.
very confidently. Yeah.
Well, that's a good... So, Joe, how do you see this app and other technologies like it helping people with various different health conditions?
Well, this is the way of the world, and like the way that things are going is digital. You know, like the first thing someone references and like pulls out is their phone, an iPad to like go for research things. You know, obviously there's a lot of misinformation on the internet, but if you can have the backing of the Heart Foundation on your apps and like legitimate, like, you know, worldwide organisations to, you know, like be, you know, to be sponsoring of that and to be endorsing it, you know, people can hopefully use their common sense to go and channel their research into those apps and get the information from credible ones, you know, but, you know, it is by far the first thing that someone will do before calling, you know, their doctor. You know, people like, it's very sad people don't engage and want to communicate. There's, you know, we've lost that maybe with digital, like, you know, with technology, maybe we've lost that a little bit, but that's okay as long as we fix, like, you know, keep that line of communication open where they can get it from somewhere else. But I feel that technology is the first thing, you know, the first point of reference for people, and to be able to have like a gaming type of app where it is challenging you and testing you, it's fun, it's interactive. I'm a big believer, and I've studied it, doing a lot of personal development, which I've done. I know the facts of, like, when you do things that are fun, you have more, you hold more of that information, you know, and this is like the most important information. Like, it's not a little thing. Like, even though it's fun, like, I have stressed that it's not a joke. There's a fine line between that, you know, and that's where with the tones of the characters, I said, you know, like, some people, like, all different people work differently. Some people like an approach where someone talks to them really passively and quietly and encourages them quietly. Another person needs to be sternly put in place a little bit and guided. You know, some people like to be led. And, you know, it's what we've taken on board with this whole app and the avatars, to be as realistic as possible, where people can choose that as well, because, you know, like, how you like react to certain behaviours and tones and things like that. So, you know, like, it's something that's going to get the information across. Very, very easily digestible it is, and they're going to retain a lot more of it, you know, because there's that element of a test. So, like, you know, like, Professor Robin has been telling me how, you know, she's had colleagues and they go, I got all my like things right. Well, that's a great thing, and I'm like that in my, you know, I'm like that in myself. And to tell you the honest truth, when this came out, they did, the study was they had a certain number of people that had, like, the app, say Fluid Watchers app, and a certain, like, number didn't have it, and then they just gave the information freely, and then they checked who knew what at the end of it. I was actually without the app. I didn't get the app. I never saw this app until I spoke to Professor Robin, and that's when I was without it, but I got everything right, because I find that this is the most important thing. Because I've got heart disease, like, it's the biggest killer in the world. I need to, like, either take this seriously and learn all the things that I need to learn and adapt my life to it, you know, or I don't really care about my life and I'll probably lose it. So, you know, like, I've still had that thing about wanting to, you know, I'm just really, really fanatical in that way, that I took it seriously, but a lot of people aren't. And some people don't have they don't have that ability to be able to retain so much. So this is a way that is proven that will help that, you know, and that's a big thing. Like, statistically, it is all in the benefit. But, you know, like, statistics aren't the whole story, but you've got to go with that, you know, and it's just comes from beautiful people. Everything that we've done together is beautiful. It comes from love, and that there, like, in the end product is what makes the difference. People feel that, even though it's not one-on-one direct, the love we put in, it gets across and people respond well to it, you know.
Thank you. That was a very passionate response, Joe. I appreciate that. If we move back to games, Justin, and talking more generally, I guess digital games are commonly seen as something for young people. Do you think that the games can work for all audiences, or are digital health solutions like this really only suited for the younger demographic?
Yeah, I think I kind of touched on this before a little bit. I think our digital literacy is gaining all the time. As a game developer and designer, we label people with a gamer age. So you might have a 5-year-old with, like, you know, 4 years of, like, digital gaming experience, but you might have someone who's 80 who's only played games for a year. So the 80-year-old is actually 1 year old and the 5-year-old is 4 years old, is gamer age. But we find those ages are always creeping up. So I think it's important to recognise, you know, this is, you know, we've all got one of these in our pocket. We take it with us everywhere, and yes, our digital literacy is increasing all the time. So yeah, absolutely. I think yeah, the games are and digital content is absolutely the way of the future.
I've got another question from Brooke for you, Justin. Did you have experience previously with healthcare app development?
We have done some other games. We've worked with the Centre for the History of Emotions, University of Western Australia and the Queen Mary University of London, developing a game around emotional literacy and wellbeing. And that was a really interesting project because it was teaching these topics of resilience and well-being, but within an entertainment wrapper, and it was actually designed to be sold as a commercial product on digital distribution stores. So we were actually teaching people covertly to be more resilient just through what they thought was just pure entertainment. So that project is still in development at the moment. So yeah.
We've got a few questions coming through asking about sort of future work. So from Linda, Are you looking to develop any other technologies? And I guess also from Scott, are you planning any updates with more features, for example, around healthy eating or exercise tips? So I don't know who wants to. Robin, are you planning sort of more generally expanding?
Yes, we're a little overwhelmed with the response to our apps at the moment. We have a Swiss pharmaceutical company who wants to use it for their research to teach a new blood clotting drug, blood clotting busting drug. We have, obviously I mentioned the Aboriginal and Torres Strait Islander people want a version of Fluid Watchers, which is going to be really interesting. And we've started our first translation into Mandarin. There's a large project in Victoria at the moment where Nurse Cora is going to be involved in teaching the areas, the geographical areas that have the most heart attack. So they're going to make sure that she's part of their statewide education program. So we were hearing about that today at a meeting, which is interesting. And also we're just in the process of giving Cora a more human personality, which is fascinating. And you saw a little glimpse in my slides there of Cora becoming more 3D. So we're advancing within our project the technology, and I'd love to see her more 3D with the personality. And I know the scripts that we're developing, one of the things she says, Jo, is, now I'm going to use my serious voice. So I think it's a switch between the gaming and the fun, and okay, this bit's probably important. So I love that, interaction. So giving her a more human nature is really good. As far as technology goes, yes, we've talked about all sorts of things on the drawing board, like a button that patients could press if they are having those symptoms, and they let a significant other know if they're alone somewhere. That could be important. And then with the heart failure Fluid Watchers, maybe we could get some Bluetooth weights and blood pressures and activity monitoring coming in, and then expand the self-care and the self-monitoring. So they are all our plans for the future, which there's probably no limit to what we could do with these apps. We are also involved in a big telehealth project, which is another version of technology delivering care, and these apps will be integrated into making sure that they get out to country patients as well via telehealth and video conferencing. So lots of plans for us in the future. Yeah, really, really good.
Adding telehealth to expand the reach of the work that you're currently doing.
Yes, exactly. And Justin and I, the cancer folks are very interested in coming and talking to us and getting cancer versions of what obviously Nurse Cora's perfect and teaches perfectly guideline-based education every time. So she could do cancer treatment education. So yes, there's some interest from that. So enormous potential. The technology has no limits. And finally, I think to wrap it all back again, could Cora, Justin, become a 3D hologram where she pops out of your iPad and talks to you, it's very close. It's very close.
We just need R2D2.
Yes, well, yes. Or Voxon are already doing it.
Jo, do you play games sort of more generally in your life? Are you a bit of a gamer?
I think.
Yeah.
Yeah, like I don't sit and game as such. I have been in that. I have gone through those periods in my life, but never like spent many years doing it or ever continued doing it. But I've lived life. I haven't watched many movies. I've gone out and like every day's like a movie to me. Like I even say, like if people could be inside my head and see with my eyes what I get up to in a day, the people I meet, like I live a beautiful life, and it's life is like a journey, and I get up each day and I try and stay positive, and look at life like a game, because like I really do believe that anyone can achieve anything in life. Like we've done this together. This is the first time I got to meet everyone, including yourself, Belinda. Like, it's the first time tonight, and we've been doing this for how many months has it been? It's been, a long time, nearly a couple of years. So to be able to do that, and not be together at any stage because of this COVID, but whatever challenges we face in life, that's amazing and it's beautiful. But like that was it's like a game. That was like what happened to us as we were playing the game. That's like a monster coming out and stopping us. You're not doing this. Mm-hmm. And we had to stay, resilient and stay the course and work out a way that we could get this done. And like tonight we're doing it live. It's amazing. It's beautiful. But life is a game and we should just we've got unlimited lives. I was saying before, until we die properly and leave this planet, we're still alive. So it's like we're playing a video game with unlimited lives. So look at it like you've got the cheat. You've just put in the cheat, unlimited lives, and just keep going, like pick yourself up from wherever you stumbled or whatever's happened and just learn from that and go, oh yeah, I've got the cheat here, and just keep going and you will win, I love it. I love life. I love every aspect of life, and not to say that every day's great, but when I look back at the reasoning behind it, it is beautiful. Like, it's all beautiful.
What a lovely outlook. Yeah. Thank you. We've got a question from Sandra who asks, does the app have questions that follow up if a patient has called the ambulance or doctor?
No. We definitely are at the stage with particularly the nurse Cora heart attack emergency plan that we don't want them on the app while they're actually having their symptoms. So the idea is that you learn from the app and you play the app. And importantly, we also have been encouraging family and carers to play the app and get familiar with it, because it's very likely that they'll be the responders rather than the person themselves. But at this stage, no, we prefer you not to be playing a game while you're having your chest pain symptoms, your heart attack symptoms.
Can I just build on a point that you just raised then? It was about using the app as a family together. It's interesting that some of the feedback that you had as part of the trials that we did was that through careful tutorialisation of how to use the app, the patients were actually becoming more digitally literate as well, learning to swipe and tap and do all these things, which gave them confidence then to use other apps and more confidence in using the technology, which started to build a bridge between them and their children and their grandchildren as well. So in your point before, when you're saying that it's helping in some ways it's driving people apart, in other ways it's actually helping to bring people together as well.
Yeah, we did know that we were providing a iPad education service for elders, and one of the gentlemen saw us. Said he'd seen his grandkids doing this thing and he didn't know what this thing was all about, but they were doing it to their phones and iPads. And then he gets his app and he goes, look at me, look at Gramps, look what I'm doing. So we were building a bridge. And there was another thing that we advised as well, Justin, with it. Look, if you mess it up or you're not sure, you forget how to turn it on, just ask one of the grandkids and they'll do it for you. So we actually had inbuilt IT support, and it seems to have worked really, really well. Although we had lots of teaching and instructions, and I think that was a side effect. Once we taught them how to use our iPad or our tablet, then they were often running with emails and, movies and online shopping or whatever was going on. We'd open the doors. So, we're pretty proud of that, and we're aware of that. And I think I think that's the great divide. We also learnt that elders are not technophobic. They're just old dogs who need a new trick, who need to learn the new trick, so that if there's someone who's willing to teach, they are willing learners. They're very willing at the moment. Yeah, absolutely. So it's a new generation. I think not factoring in socio-economic issues, which I mentioned. And that's really important feedback that we received as well. None of our apps are live at the moment or live and connected to the internet, although I mentioned that's something we want in the future. But they certainly don't want our apps consuming all their internet access for a month or whatever and have nothing left to do their messaging and emails. So we have to be aware of the balance between those two things, you know.
But I really love that unintended side
Yeah.
effect
Byproduct,
that
yeah.
really reaches out into somebody's life more generally. That's a great.
Yep,
that's
it was a great
point.
side effect, so
Yeah,
to
it's
speak.
nice.
Yeah.
Well, we don't have any more questions here, so we've had a lot of great interest and participation from the audience out there. But I'd like to just ask each of you if there are any takeaway messages from this discussion that you'd like to leave the audience with. So I'll give you some thinking time, but who wants to go first?
I'm really excited about the collaboration because it really brings the art, game and story, I'll put that in one bucket for now, the technology and the science. And it's those three things coming together. And if you draw a Venn diagram, it's that little overlap in between that really the best bits of all of those really fusing together to create this quite innovative new approach to digital, to health solutions, really. And it's that gets me really excited about this. And I think I see great potential in it.
Great. Jerry, do you want
Great,
to?
Justin. Yeah, I'd like to leave with a bit of a message to everyone, and that would be to get involved. And you might come across a time or something that happens to you in life where, you say, as like I did, I was diagnosed with heart disease, and it takes you by surprise and shock. You'll go through life and everyone gets something. Everyone's got something that happens in their life, but at that time where it knocks you back, just realise that it's not like I've got a disability. I don't look at it in the way I've got a disability, and I think that people should when they realise that something's happened to them, and now they've got something, a illness or whatever it is, look at that as actually gaining something. And from the moment that they found out about it, however they found out about it, they've gained experience. And that experience and knowledge that they've gained from that very moment is what is so important and essential. The story that they tell from there, just retelling their story in their own way of how that came about and what they went through, just being open, no script, but just telling their story, is so powerful at helping another human being on this planet. And that, reach out to the people around you, to healthcare professionals, to the pharmacist, to everyone who helps you in your way. Ask if there's anything that you can do, or if they know about anything going on that you can give back to, because, I'm one loud, proud, outrageous sort of guy. But, when I give a message, it doesn't respond with everyone. Some people, whoa, this guy's too much, and they'll turn the channel off. It's everyone's got a frequency that we respond with, and we need everyone to be able to give off the good message and give hope and be loving and kind, and gentle with each other, because we can make a difference. And, I didn't realise this until a lot older. I was a very shy guy growing up, and I didn't think that my voice was important, because you think that you have to achieve a certain level or do something until you're important. But I always took things in, and I had so much feeling about life because I got so much love. And when I was the ambassador for Beyond Blue, and I started talking about my story, and I raised all this money for people with depression, but money's never been a thing for me. But I learnt that just telling my story, I was 30 years old and I had this fear and this anxiety, and I was telling people that I run home to my parents, asked if I could sleep in between them when I was a baby.
Yeah.
And I had no fear to say that. And how people wouldn't say that, as a grown man. But, I said it because I'm just being humbled by the experience, and there's nothing wrong with that, but how people responded came up to me, people that would never have thought were inspired by that to be able to then talk.
Yeah.
It's the same with anything that we go through. It's so important, and everyone has, everyone's worth so much, is priceless, and they can really give. I really would suggest for everyone to just try and do that. Try and
Everyone can make a difference.
everyone
That's
can make a
great.
difference. It's
So-
unbelievable. They're here. Everyone's
And-
priceless, and have
Great.
got value to give.
Great. And Robin, just very quickly, a
Yes.
takeaway point.
Our avatars deliver an evidence-based, word-perfect educational session every time that's fun and interactive. No pamphlet or booklet can give you that much fun or can ever deliver that. The most common question that patients and families ask us is there an app for that? What app should I use? And I can say quite confidently that the apps that we're producing are high quality, clinically tested, co-designed, and made with love, as Jo said. And so the work that's coming from the Caring Futures Institute and Flinders is the highest quality, so go for our apps, yes.
Wonderful. What a lovely way to finish. Thank you, Robin. And thank you to Justin and Jo.
Thank you.
Thank you for sharing your knowledges and experience tonight. I'd like to thank our audience and for your questions, your input and your interest in this event. And remember that you can watch this session again on the Flinders YouTube channel or the Flinders Brave webpage, where you can also register to receive notifications for our future events. And if you're interested in finding out more about the work from the Caring Futures Institute, you can access the website via theflinders.edu.au or by Googling Caring Futures Institute. Thank you once again and good night.